Hello everyone and welcome to Annotated Medical Tutorials. Today we want to take a quick look at a condition called dry socket. We all know that after a tooth extraction, we expect that the pain should go away day by day until the patient completely heals. But unfortunately, some patients come back to the clinic complaining that 2 to 3 days after the extraction, they started experiencing excruciating pain, which they describe as worse than the tooth that was extracted there. So when this happens, you shouldn't panic, but know that your patient has developed a dry socket and it should be treated. So a dry socket is a condition in which the clot that was in the socket has been dislodged or has been dissolved. So for us to understand dry socket very well, let us first of all look at how a normal wound heals after a tooth extraction. So after a tooth extraction, the socket becomes hollow, but blood will quickly fill it up and it will occupy the whole space. This will block food from getting inside, and it will also cover the bone walls and the nerves that are being exposed there. So if the clot is maintained, just a few weeks later, new bone begins to form in the area, and also new blood vessels begin to form in the area, and the space will be mixed with new blood vessels and new bone that is being formed, such that after 4 weeks, this whole space would have been occupied by complete bone that has been formed, and the whole area will be covered by the normal mucous membrane found inside the oral mucosa. However, in some cases, some patients lose the blood clot, either by dislodgement or by dissolving. So if the patient loses the blood clot, that socket becomes hollow again and exposed. We call it dry because it does not contain the normal contents that are supposed to be there. So all the nerves, which I'm indicating in yellow, will be exposed. These nerves will pick the inflammation inside the area, and it will be excruciating pain that the patient describes as being worse than the pain that they were experiencing before they came for the extraction in the first place. So now we are in a position to properly define a dry socket. So by definition, a dry socket is a condition in which the patient experiences excruciating pain about 24 to 72 hours after the extraction. The causes of a dry socket are still under research, but they are well-known predisposing factors. So the first predisposing factor is a traumatic extraction. So just know that whenever you have got a difficult extraction, a dry socket is most likely going to happen. Another risk factor of dry socket is poor oral hygiene. So it is of paramount importance that you emphasize on oral health instructions, including oral hygiene. Another risk factor of a dry socket is smoking. Smoking creates a negative pressure inside the mouth, such that it will easily plug out or suction out the clot from its position. So this mechanism will be by dislodgement of a socket, which brings us to the next in our list of risk factors for dry socket, which is the use of a straw. The use of a straw also is compared to smoking in a way that it creates a negative pressure inside the mouth that will suck out the clot from the socket. Last but not least, on our list today, we have got oral contraceptive pills. If the patient is a female and they are on oral contraceptive pills, we should make sure that we have utilized, if possible, the 23rd to the 28th day of their menstrual cycle. Now let's talk about the etiology of a dry socket. We want to talk specifically about Ben's hypothesis. And in this case, Ben's hypothesis, it emphasizes on the effect of trauma during the extraction, and it says that if the extraction is traumatic, there will be inflammation of the bone marrow, which will cause the release of tissue plasminogen activator, which will convert plasminogen to plasmin, and the plasmin will then dissolve the clot. From this, we move on to the clinical features of a dry socket. So the diagnosis of a dry socket is mainly clinical because you just listen to what the patient tells you. The patient presents with severe pain 24 to 72 hours after the extraction, in which they describe it as excruciating pain, which was worse than the tooth extraction. Number 2, there is halitosis because food will be pecking in the socket that the clot has been dislodged. Number 3, we've got exposure of the bone. You can literally see the bone inside the socket. So from this, we quickly go to the management of a dry socket. We need to make sure that we manage it pre-operatively, intra-operatively, and post-operative. So pre-operatively, we need to assess the severity of inflammation. If there is active pericoronitis that you can see, then don't do the extraction. We need also to do an S&P before so that we can improve the oral hygiene. If the patient is on oral contraceptives, if possible, make sure that you do the extraction on the 23rd day to the 28th day of their menstrual cycle. If the patient is a smoker, we need to advise them to stop smoking 10 days before the day of extraction and also 10 days after extraction. Also, you need to take an X-ray so that you can assess the level of bone, the level of impaction, and the angles at which the tooth is inclined. This will also assess the severity of the trauma that you are going to impose on the patient. So now let's take a quick look at the pharmacological aspects of the management of a dry socket. In this case, we're not going to do them in order. So the first one would be to prescribe some antibacterials. Right. We need to prescribe some antibacterials. This will make sure that the socket has not been infected, in which case it would be called a septic socket. So we also need to use some antiseptic irrigants to irrigate the whole socket. And we also need to make sure that we use painkillers, strong painkillers to cover the patient because they've got excruciating pain. So they need a very strong painkiller. And then also we have got what we call clot stabilizing factors, which are antifibrinolytics. An example that we have is a drug called tranexamic acid. Another aspect that we need to make sure that we have used in the treatment of dry socket would be a substance called alvogel. Alvogel contains iodoform, which will act as an antibacterial itself, and it also contains zinc oxide eugenol, which will act as an analgesic and also as a healing factor. We also need to make sure that we have created fresh blood that will again refill the dry socket. So we need to make sure that we have scraped the walls and then look for blood anywhere else that will fill the socket. Before you give the patient a gauze to bite on, make sure that you suture the socket if it is too exposed. But if it's not, if the suture is not necessary, then don't do it. So in summary, we say that a dry socket is a condition in which the patient experiences excruciating pain 2 to 3 days after extraction. This is mainly because of loss of the clot that occupied the socket due to two main ways. It said that the clot has been dislodged or it has been dissolved. The main aim of the treatment of a dry socket is to make sure that we form a fresh clot that will occupy the dry socket. This will help the patient to heal and relieve the pain. If you find this video helpful, please support us by subscribing to our channel, which is absolutely free, so that we can keep on creating the content.